Welcome to this week's podcast, where we're going to be talking about something that's been big and hyped in the news and in the research and is all the craze right now. And we might have a different stance on it than what you think. So we're going to talk today about semaglutide. And I am Jenny Cortano. This is Rachel Hicks. And we come at this from a perspective of functional medicine, holistic health, and nutrition as an approach to improving your health without the side effects of medication and things like that. So let's get started. So Rachel, I'm going to let you kick us off because I know you went down a rabbit hole of research as we were getting ready for this. And let's talk a little bit about semaglutide and why it's such a craze right now. What's the history behind it? How did we get here?
Yeah. Once you get to know me a little better, you're going to know that rabbit hole comes very easily to me. And this is a topic that it definitely happened to me with. Semaglutide is this really interesting drug that's out on the market now. And there's several different forms of semaglutide. So you might have heard of Ozempic or Wegovy, and these are all just another name of what semaglutide actually is. Originally, Jenny, the drug had been, brought to the market through Big Pharma trying to help type 2 diabetics. And originally, that's how the drug was used, as to help control insulin levels and to uptake glucose into the bloodstream, right? To help stabilize blood sugar. During this time in research, people started to notice when they started taking this drug and their blood sugar started to become regulated, that they also were losing weight.
Right.
So, as we know, obesity is something very prevalent in the United States that we're dealing with all of the time. And we deal with our practice as well, as helping people understand the right ways to eat and lose weight and move their bodies. And sometimes there's supplements involved, sometimes there's not. So there's always that want to know more basis when it comes to how to lose weight. And when people started seeing that these medications were helping them lose weight, there was definitely this big craze of where and how can I get my hands on those drugs to help me lose weight this way. So one of the things I like to preface is not everything comes to you at face value, right? It's not always what it seems. And I truly feel this when it comes to semaglutide or any of these other marketed weight loss drugs that are primarily supposed to be used for blood sugar regulation. And how this all works is that part of this drug is included is this thing called GLP-1, which is a glucagon-like peptide. So in that peptide, it is basically a chain of amino acids, right? So it helps secrete insulin and it helps regulate blood sugar. People with type 2 diabetes have lost that, or it's reduced in their body, making it super difficult for them to regulate blood sugar. So they go on these medications to help with blood sugar control. When people are going on these for different reasons and they don't have diabetes or they don't have a dysregulated A1C or they don't have blood sugar problems and they're strictly using it for weight loss, there's a different component that comes with this and different side effects as well.
Yeah.
And
Yeah. So I appreciate what you just said. And I think this is so important, right? Because when we talk from a functional medicine standpoint, we talk hormones, we talk not only how are they created, which is something we're impacting with this. Then we're talking about how are they transported, which is also going to be affected in some ways by this. How are they, how's the sensitivity to them, which is a big part of this, right? Making it more sensitive so we get more uptake. And then how are they excreted from our body? And so all of those pieces are super important to consider. It's not just, is this going to make me lose weight, but how is this going to affect my entire hormone system? And now and in the future. And that I think leads into some of the side effects that we have as well.
And so one of the main things that ends up happening on these medications is that you have a pretty drastic reduction in appetite. So you are titrated onto the medicine, which means that you are gradually increased. So it's not happening all at once. You're not getting one big dose of semaglutide, but you are getting a weekly shot. And that's how it is administered throughout the whole process of this drug. But they start with a smaller dose and see how you adapt. And they give you a little bit more each week. Now, as your body starts to adapt to this drug, you start to notice a reduction in appetite. And that's due to the fact of that GLP-1 is controlling your hunger hormones, that leptin and ghrelin, transferring the thoughts to your hypothalamus, your brain. So that's where I think a lot of this weight loss is coming, right? So it's slowing gastric emptying. So in the dietetic world, we talk a lot about the gut. We talk a lot about when food comes in and how food goes out. And when you delay gastric emptying, it in turn just makes you feel full longer. And that's what's happening with this drug. And that's why people are seeing the weight loss.
Sure. And so another side effect that I've read a fair amount about is the risk to the pancreas, right? Because what we're basically doing is coaching the pancreas to say, come on, we've got to do this. We've got to take up more insulin when it's in the body, right? And that's the mechanism that it helps the diabetes piece of it, right? We have decreased sensitivity, so we create more of it. And so that's partially how it works. So the problem some people experience that can be very serious is pancreatitis when they're going through this or when they're coming off of it as well, which is another, just a whole different side effect and potential problem, right, for folks down the line in terms of eliminating one problem. And I'm not saying there's not a place for it, because there definitely is, but if you're not using it for the right reasons and in the right way and under the right prescribing eye, I think can be a risk as well.
Absolutely. And there are guidelines of whether or not you are able to take this drug. One of them being if you have thyroid cancer history, anyone in your family, and the other being pancreatitis. So those
Right.
alone could be red flags to say, even if I have a healthy pancreas, even if I have a healthy thyroid, what is that doing to it? So those are questions to ask yourself. On top of the actual potential damage to your pancreas, lots of people experience the nausea, vomiting, diarrhea, sometimes
Right.
crippling to the point that like I've listened to interviews of people having to actually stop taking it after a couple of weeks because it was so severe.
Right.
And what isn't talked a lot about with the side effects of these drugs is the immense amount of muscle mass that people lose
Yes.
on it. So say, for instance, Jenny, there's a woman coming in that's 50, maybe let's say not even say an age, let's say postmenopausal coming in,
Yeah.
already at risk of muscle mass loss as we age as a woman, correct?
Yeah.
She goes on one of these weight loss drugs for the sake of this conversation, where she goes on semaglutide and she's on it for 2 months and experiences a ton of muscle mass loss at that point.
Right.
She comes off the drug and she, at that point of her life, at being a postmenopausal woman, the amount of work she would have to do to try to gain back that muscle mass at that point of her life is so difficult. And we know with loss of muscle mass what that does to morbidity, mortality in especially women as we lose muscle mass. So that's a significant side effect that I want to point out to these drugs.
That's huge. And I appreciate you bringing that up, because I think that's so critical to our population in particular, right? We're seeing a lot. We work a lot with women who are in those post-childbearing years, early menopause, premenopausal states. And we need to do whatever we can to preserve bone density, to preserve muscle mass, to make sure that we're setting that body up for success long-term, because like you said, it affects the longevity of your life, but it also affects the quality of your life and the risk factors that go up as we lose muscle mass. And we know we do that as hormones change as we age anyway. We certainly don't want to do anything to expedite that process.
Absolutely. And so let's talk about what if we want to come off the drug? What happens to our body when we want to come off of it?
Yeah.
Literature shows right now that there is a 90 to 100% weight gain return,
Yeah.
sometimes more. So studies are showing that a lot of people are almost becoming more worse off coming off of the drug if they're using it for weight loss
Right.
purposes than they were prior to going on this medication.
Right.
So a lot of studies are showing this insatiable hunger that comes back.
Right.
And there are methods, I think, of weaning off of the drug, right? That is maybe not going cold turkey. Maybe there's lots of people that have given their suggestions of how to come off of these weight loss drugs, but nonetheless, you have changed your body's ability to utilize energy. So you go, say you're on the drug for 2 months, and one of my concerns being on this is what's your nutrient level like at this point? Some people are at 500 calories a day on these drugs.
That's insane, right? We know the body can't sustain all the things we need to do and continue to build healthy longevity on that kind of calorie intake.
And then even in those 500 calories, are you even able to get the nutrient value that your body needs? Five. And this is where the muscle mass loss comes. This is where immunity issues start to play in.
Yeah.
Loss of hair, sagging skin. There are things like this that occur with this drug,
Sure.
or these drugs, better said. So those are things to really consider, because then when you come off of the drug, there is some concern. And I use this term really loosely because I don't believe people are going to be malnourished, but there is a sense of feeling malnourished.
Sure.
And I mean that in the sense that you've gone so long, sometime upwards of 2 to 6 months on this drug, of eating minimal calories with minimal vital nutrients that your body needs. So then you go off it and your body is, give me everything not nailed down. I want to
Right.
eat it.
That rebound effect, right? And then on top of it, your body has a new metabolism it's used to working with, right? So the set point theory of weight. And we now are going to increase that calorie naturally because we are more hungry and our body isn't used to using that many calories. And so that is partially, from what I understand, where that rebound weight comes back from as well. But anything you want to add to that?
With it, pretty much you've nailed it. But with the additional calories that you're eating from that rebound effect, your body isn't utilizing it the way that it's meant to utilize it, because it's been in the sense of essential starvation for these
Right.
months that you've been on semaglutide. So it's what we know is going to happen is that it's not being sent to the brain, to the muscles, to the proper organs to be stored. It's going to the fat cells and it's being stored
Right.
as fat.
Right. It's that whole transport piece we just talked about. Yep, absolutely. You're changing all of that and you have to consider all of that. Sure.
So there's the scaries, right? We talked a lot about the scaries and everyone's, I'm never touching that. Now, I do like to preface with saying there is a place for this. And especially if you have a lot of blood sugar dysregulation, or if you've exhausted all of your options, right? And
Yeah.
that's where we're really going to take it to this next phase of the discussion of how, if you've hit that wall, right? If you've said, I've tried the supplements, I've tried the diet and lifestyle, it's not working, your numbers of the labs are changing, your blood sugar starts to become dysregulated, maybe you're a candidate for this, right?
Mm-hmm. Mm-hmm.
What's the best way to use this drug?
And so I think you just brought up a really good point though, because I think the drug companies don't advertise very often. And although I think good companies who are working with these class of drugs are also encouraging lifestyle changes, I think the lifestyle change in and of itself is so important. And without the drug can make a lot of difference, particularly for those who are looking for long-term sustainable changes in their life, right? So let's talk a little bit about what that looks like now. And we're going to talk in generalities. Of course, this is not meant to be medical advice. It's just our take on this as practitioners and some suggestions as to ways you can maybe start to work through this on your own. And of course, if you work with us, we dive in much deeper and come up with a personalized plan on this. But let's take a look at some of those factors that we know, right? GLP-1 is in our body. It doesn't take semaglutide to bring that. How do we naturally increase that and other things that are going to improve our blood sugar regulation, our gut health, which is going to in turn increase GLP-1. And so I want to dive in a little bit to that now, if you're ready.
Yeah, absolutely. Let's do
Awesome.
it.
Okay. So I think first of all, we talked a little bit, we've mentioned diet. And yes, I know diet is a hard thing to think about, but I think so many people approach diet, and you could speak to this a little bit more, thinking more about, I have to take this out, right? And calorie restriction and things like that, which we know also are not always sustainable. And so I think when we think about diet from this context, I'm thinking more about what should we add to our diet that is going to help support healthy digestion, gut health, which is going to in turn promote healthy GLP-1 activity, all of those things. So you have a couple of suggestions, and then I've got a couple to add to it as well.
Yeah. So like looking at the basics of things you can buy in the supermarket, right? Just general food itself, is making sure that you are getting adequate protein, getting those amino acids in your body. So amino acids are chains of these proteins that make up the peptides that help build muscle and help your metabolism speed up. So getting an adequate amount, almost like being like overly mindful of how much protein you're eating. Like I push like the women in my practice to eat as much protein as makes sense for their body weight.
Yeah.
We calculate it down to make sure as they age that their muscle mass stays high. So that's the first thing I would say, is really hone in on those lean proteins, your eggs, your chickens, your turkeys, all of that stuff. And obviously, I'm not saying beef and stuff, beef or red meat is bad, but I tend to push people towards more of the Mediterranean proteins of fish and chicken and things like that. Just getting a adequate amount of protein. And then we talk fibers. So all your big leafy greens, your broccolis, your cauliflower, and vegetables and fruit. So with adequate fiber also comes the ability for you to have really good gut health, which the GLP-1 is secreted in the gut lining. So in order to have a healthy gut and to have healthy GLP secretion, you want to make sure you're eating a lot of high fiber and high protein in the diet. And that's just really like simple. Protein and fiber is a good place for us to start. And what that in turn does is it makes you mindful of eating whole foods, whole clean foods, eating lots of different colors. And that can be hard. I am empathetic with that. It sometimes does seem easier to take a pill and have the problem fixed. But when we look long term, we're actually creating a disservice to our bodies when we decide to go the easy route sometimes and not put the legwork in on that front half and really dig your heels in and say, I'm going to change my lifestyle through my diet and the way I move my body every day. But I need to stress this, that I know that it is not easy. Like it is hard. And so I tell patients that, like, absolutely, I'm here beside you. We are going to dig our heels in and make it work, because I am not naive to how much work goes into changing habits.
Right. Well, and I think that's part of why we value having somebody walk with you, right? You're going to spend a whole lot of money if you choose to go down this route of this class of drugs, which unfortunately may or may not stick, if you don't also have those lifestyle changes that go along with it. And that is,
like,
oh my gosh,
$1,000 to $1,500 a month if they're not covered by insurance, which we didn't even touch on that, the expense piece. Like they're astronomical.
Right. And you aren't guaranteed any lifestyle changes that are going to stick after this, which is what's going to make the long-term effect much more valuable. Yeah. So I love that. And I think in addition to that, I would add there are certain herbs, spices, things like that, different classes of food. So you already touched on your leafy greens and having a lot of fiber. I would say a lot of your blues, reds, like grapes, resveratrols is the class of food. It can be really helpful as well. They help balance hormones, but they can also help when we talk about this whole gut health and GLP-1 component as well. Cooking with things like cinnamon can be really helpful. That's another one. And then there's other things. And again, we dive in and come up with a personalized plan. But I think what you just said, and I want to reiterate about diet, is it's a gut health component, right? So if you have a healthy gut, you're going to make a healthy level of GLP-1, among other things that are going to help. And gut health comes from lots of different things, but the best thing we can do is put the right things in it to begin with, which is going to make a difference. You also touched on another thing in there, and I wanted to dive into this a little deeper with my passion and background as a PT, moving every day, right? Moving your body, both for detox purposes, but also for maintaining muscle mass, especially as we age. And when we talk about this in terms of weight loss, having a larger bulk of muscle mass is critical to keeping your blood sugar regulated and keeping your weight managed as well. So those are important pieces on several fronts that are going to affect this as well. I think that's another huge one. Sleep, and we dive into this a lot, so we're not going to dive in too much today, but I think sleep is super important as well, and appreciating that not only do we know from the research that you make poor dietary choices when you've had a poor night's sleep, but sleep is also where your body does a lot of its repairing, remodeling, and restoring and getting ready for the next day. So those are both critical components.
Yeah. And you made me start thinking, my wheels were turning with this, is that even with this podcast, if it brings like a conversation that allows somebody to step outside of that traditional path of treatment for losing weight or their traditional path of improving their health, and look at the way we practice in this functional manner so differently, looking at us and saying, oh wow, it's more of a big picture when we start diving into people we're working with. And I think what's so unique and really important to highlight is that it is an individualized plan of attack for each person. So we might have 20 women that want to lose 20 pounds, but each woman has such a different plan that we work with them through. And gut health being really prevalent, really important in most of the people I work with. And right then, when you start improving the gut, people start to see all these different changes happen in their body, whether it's lower anxiety and depression, or more energy, or blood sugar regulation, or sleeping better, or less aches and pains, or whatever it might be. The
All
list
those things.
goes on and on, because so much happens in the gut and the
Right.
direct correlation to the brain. So I think it's really important to say that, yes, it takes time, it takes work, but it's not when we look at health, when we look at our bodies, it's not this pinpoint with a circle. This is what we have to fix, this little circle right here. It's not
Right.
how it works, right? Like, we have to look at the system of a whole. Like, where is the dominoes falling and why is it falling like that? And that's when you solve the problem and not treat the symptom. I say it all the time, right?
Yep. Absolutely.
So semaglutide is treating the symptom of weight loss because you're losing weight.
Right.
What it's not treating the problem of why the weight was on to begin with.
Absolutely. And I think that is such a multifaceted approach, like you just said, right? There are so many factors and it's so individual, right? There's stress, there is diet, there is exercise, there is lifestyle, there's sedentariness, right? All of those things are going to impact why somebody may or may not be holding onto the weight, among other things. And so we really dive into that root cause of what's going on to help you achieve your goals, but in a way that doesn't require this quick fix that unfortunately long term may or may not be effective, and at the very least cost you a whole lot of money. So that said, I think one of the things you did mention and we appreciate, right, is it can be overwhelming to get started. And so if, again, you and your doctor decide this is a good fit for you, we're not saying don't do it. I will say there are other alternatives, and we use sometimes things like supplements in our practice to get somebody on that right path, right? Between our lifestyle, the food intake we have nowadays, we're missing a lot of things. And so there are also natural ways that I think we would be remiss if we didn't bring up. I've got a couple of really good supplements that I like that can support feelings of fullness, that can support initiating that weight loss, and have some pretty good research behind them to start saying when you take these things compared to a calorie restricted diet, there is improvements in weight loss. Or when you take these things, we do see the increase in GLP-1. So if you're thinking right now, that sounds totally overwhelming, I can't start with those dietary changes because I don't have the energy, because I am exhausted at the end of the day. And yes, weight loss is one of those pieces, but it doesn't tell the whole story. There are other options. There are some supplements and things we can do that are natural, but still going to support you in that process while we work on the lifestyle changes that are long-term going to make those effective changes for you.
Yeah, that's great. That's great advice. And I do think just even making the first phone call and saying, hey, I heard this, I'm interested in this, or what is this about? Start asking questions. Just feel like you've exhausted all of your options before you feel like you have to make a big leap into something that could be risky.
Yeah, absolutely. And like you said, knowing there's something else out there, right? We as providers don't have the backing that pharma has to push this. And if we could eliminate these kinds of ads from TV, or have a comparison to be able to say, hey, we also have this opportunity to do this, it doesn't require you to take this risky medication, I feel like people would be more informed. And so that's just one of the goals of this podcast, is to get the information out there, let people know there's another way, and that it doesn't have to be the way that pharmacy or insurance or things like that might dictate that you should do it.
It's far less risky with
Oh,
much longer effects.
yeah, absolutely. So with that, I think we're going to sign off for today. If you've heard something today that piqued your interest, you can find us on Facebook, on Instagram, Altogether Woman, our website, www.altogetherwellness.net, where you can book a call with either Rachel or myself and learn more. We are happy to support you guys. Until next time.